Welcome to the podcast series, Unshakable Strength Empowering Black Women, sponsored by the Empower Project. The Empower Project is a partnership between Howard University and Health HIV, sponsored by the PACE grant from Gilead Sciences. The Girlfriends Podcast mini-series, Unshakable Strength Empowering Black Women, is dedicated to addressing the unique health challenges faced by Black women and girls, particularly in the context of HIV prevention. We will explore important topics such as sexual health, mental well-being, access to healthcare, and strategies for HIV prevention tailored to the needs of Black women and girls. We invite you to listen to our first episode, Meeting Black Women Where They Are, on a vital conversation of HIV prevention tailored for Black women already available for you. Today's episode, Unpacking the Impact, Intergenerational Trauma and Health Disparities, will unpack the nuances and complexities of intergenerational traumas and how they can manifest in our current lives. And I'd just like to introduce our speaker today. Dr. Ashley Elliott, also known as Dr. Vivid, is a doctor of clinical psychology located in Washington, D.C. She has a passion for serving those who identify as Black, Indigenous, persons of color, and members of the LGBTQIA community. I am Ashley Danso. I'm a junior at Howard University majoring in health education with a concentration in community health and a minor in biology. I'm deeply committed to addressing the health disparities within the African American community, and I can't wait to get this conversation started. So, Dr. Elliott, how are you?
I'm good. It's always great to meet another Ashley. We're everywhere. We're great.
Yes, always, always. But yeah, like I just kind of want to open the floor and just talk about what our main goal is today, intergenerational trauma. And if you could just give us an overview of what intergenerational trauma is and how it can be identified, that would be great just to start us off.
The big bucks questions right off.
Yeah.
Yes. So, intergenerational trauma is a pattern of trauma that we have seen over time, over decades. It can be intergenerational in a familial sense, meaning going back decades and decades in your family's lineage. And when we talk about a community, let's be specific to like people of color, Black folk, Indigenous folk. We're talking about the traumas that our people, our community have endured over a lifetime and beyond. So when we think of intergenerational trauma, an example is the international slave trade.
Mhm.
And intercontinentally, you saw people being taken from all over the world in different parts of the world, Africa, the Caribbean, and beyond, and displaced. So we carry that trauma from our ancestors who were on the trade. Why? Because everything that they knew and everything that they had was shifted. And
Mhm.
because of that shift, and because of that fear, because of that anxiety, that shifted the thoughts of their children and their children's children. So we're talking about, let's be specific to Black folk, because I identify as a cisgendered woman who is Black. So we talk about the slave trade, and then we talk about people coming and being on the block. On the block, you're further transitioned and shifted from your family or the family that you created and you knew. So you have
Mhm.
all of that fear, all of that worry, all of that concern, and all of the things associated with the slave trade permeating through different pieces of our family, of our community. Then we go into Jim Crow era, and it keeps going on and on, civil rights era, on and on. And we can take it now as close as what we call the era of George Foreman and Me Too movement. All of these things impact us generation to generation. The entangling of the inter is in and amongst community. So if we think that we have not been affected by slavery because it was 400 years ago, that is actually untrue. Because I got a grandma who's going to be 89 tomorrow, and she was definitely impacted by that because her parents were born in 1909 and 1913. She was
Wow.
born at the time of the war, World War II. So draft time, and she saw things, and she sat at lunch counters, and she could point out her father's lineage in connection to the slave trade. So it's not as removed as we think. If we think about our 50 and 60-year-old aunties and uncles who were also at the lunch counters, who also saw the first integration of schools, who were marching during the riots when Martin Luther King was assassinated, when Malcolm X was assassinated. All of those things are affecting us and our communities and our belief system, our value system, our sense of self, and our sense of safety. And that trauma lingers because think about mistrust of the educational system. Yeah,
Yeah.
because you weren't giving me access. You told me I didn't belong here. Mistrust of the healthcare system because we have things like the Tuskegee experiment who that were
Uh-huh.
going on. We have the slaves and those who were free who were being experimented on for healthcare advancement. We also have other studies where in the late 80s, 90s, where people weren't being given their rights, told their rights. So there was no real informed consent. And we have police. Going back to the first police being established in this country were assigned as slave catchers,
Yep.
and the mistrust that we have for the police and the law enforcement system and the justice system. Talk
Yeah.
about the Emmett Tills, it goes on and on. So
It
those things
does.
are connected to us. And though we may not have been alive directly to interact in that time, the ripple effect has affected us all as a community. Mm.
Yeah. No, definitely. What you said, like, just paints a very broad picture of what intergenerational trauma is and how deep it really runs through our blood. Like, whether
Mhm.
we want to face it or not, it's there. And it's like all these things that have happened to us as a collective are just like, they're literally just ingrained in us to the point where, I learned something a while ago. I'm taking a genetics class right now, and we're learning about epigenetics. So,
Mm.
knowing that the trauma that we've endured quite literally changes how certain genes are expressed. That is something that not a lot of people know. So it's like knowing that that is like on a cellular level, we've been affected by the trauma that we've been enduring. It's like it's insane to really think about. Like this stuff runs so deep, and we need to be able to identify it just so that we can give each other the space to kind of like figure out what we're going to do from here as a collective. Because this is just a broad context, but it's like there are so many ways that it affects our lives in different people in the Black community for sure. So it kind of leads into my next question, which is, in what ways do the echoes of historical trauma shape the narratives of individuals living with HIV today?
Ooh. It goes right back into it. So
Yeah.
we talk about, HIV and AIDS. We talk about the eruption of cases in the 80s and the early 90s. A lot of the stigma attached to HIV and AIDS was focused on certain groups. At that time, it was Black and brown men. There, of course, were white men who definitely were coming down with symptoms. And there are definitely those people actually got more care, had more access to care than Black and brown individuals. We look at different scenes when we talk about communities. DC has always had a strong scene when it comes to the queer life, queer community, New York, San Francisco, places where you were seeing more of the, I would say, tolerance, acceptance
Yeah.
of those who identified as gay, because that's what it was back then. You were gay, you were lesbian. It wasn't all of these other nomenclatures that we have because we were just figuring out how to identify ourselves at the time.
Yeah.
So you had these cases of men who were being wanted to be tested, but were scared to be tested because you could be outed from your job, you could be disowned from family members. You had people who were in the church, in politics. There was lists going around. We even talk about it on a congressional level, trying to out men and men in the arts, men in politics. So you had people who were not getting tested while they were watching their friends pass away. living in fear and not getting the treatment that they could have gotten because the fear of being outed
Yeah.
was bigger than them, and that loss was bigger than them thinking about how this could affect my life medically.
Hmm.
And a lot of that fear and stigma has permeated through the decades where we talk about gay men, especially Black and brown men, and a lot of the stories or the narratives that we see in the news or in our communities that are ill-informed just really revolve around promiscuity
Hmm.
when we know that you can get AIDS or HIV with being with one partner
Yeah.
and you just not may not know that partner's sexual history. There are also things like, the instances of blood transfusions and things like that that have gone awry. But a lot of men of color really have taken it amongst themselves to live in the shadows. Still, even though there are more men that are out, it's still that stigma of getting
Hmm.
tested. It's like I'm really letting people know that this is how I present. These are the people that I love, and this is a risk. And somebody seeing me coming out of a testing center, whether it be brick and mortar or mobile,
Yeah.
or somebody, even now, I've walked into places where the instructor or facilitator in a community or the community advocate has lost a little weight, and the immediate murmurs in the community are, oh my God, are they sick? Do they have HIV? No, they're just fasting for a marathon. They're getting their body together, but there's so much fear. And then we have
Yeah.
fear from the femme part of the community from protecting these people. So not wanting your son to be gay. I can't take that
Yeah.
because the world is going to really turn its back on you. You're going to get AIDS. That was the fear mongering. Families were
Yeah.
literally in churches were
Yeah.
literally telling Black and brown boys, hey, you're going to die. You're going to get AIDS. You're going to get HIV. You're going to die. And some people took it as, well, if I'm going to die, I'm going to just live my life the way I want to anyway. And some people were like, oh, yeah, I really need to pay attention. I need to get tested. But that also pushed some people back in the closet. And then
Yeah.
you had another group of men who were just like, yeah, this is who I am, but I need to keep it as hush as possible. And when we think about those who were actually diagnosed, so many people lost their lives alone in hospital rooms or lost their lives alone in their homes or shelters because there was some to identify as gay out loud or to get treatment because if I get treatment, then I'm going to be looked at as a pariah and my family is going to have to live with that stigma. I even know people who were I had my mother had a great friend with the most beautiful singing voice that I ever heard when I was younger. And I remember that my mother hearing conversations about him, unfortunately contracting the virus and he didn't know how he was going to maneuver it because his family was so heavy in the church. So when he ultimately did pass away, what did they tell everybody? He had cancer, you know. So that trauma
Yeah.
lends to these terrible, negative connotations and these negative narratives about gay men. All gay men aren't on down low. All gay men aren't participating in promiscuous activity that could get them HIV and AIDS or other viruses, other STDs, STIs. All gay men aren't, not really laissez-faire about their health and not checking in with themselves and their partners. But these narratives have lent to a higher instance or a different type of homophobia that it shows itself in our communities.
Yeah. No, definitely. Definitely, I feel like the homophobia that Black men experience is just like there's layers and layers and layers to it. Because I feel like as a Black man, just the way you exist, you're already looked at as like a sexual deviant because of the labels that have been put on us because of slavery, because of all those traumas that we've already dealt with. So when you have that fear already there, and then there's that added layer of homophobia, it just it just breeds this environment of so much like hostility. And that's why Black men feel like they cannot go and even take care of their health because, like you said, they'd rather like appease that social stigma than look after their health, even though they might value those two things. But that social stigma, that fear of really being isolated from your whole entire community is like it's detrimental, it's life altering. So it's not crazy to think that someone wouldn't want to go get tested, but at the end of the day, there's only so much that we can do. Like this has been such like it's just been years and years and years of just trauma and stigma that we need to undo, we need to unlearn.
Right.
So that kind of leads me to my next question, which is how does intergenerational trauma impact us on an individual level and then a community level as well?
Mm. This is the stuff that I talk about in therapy a lot with my clients. So we talk about like, the example of HIV, AIDS, and stigma and homophobia, how that affects, that's a community level. On an individual level, it shapes our belief systems, it shapes our fears, it shapes our anxieties or creates those anxieties for us. So we talked about how that can affect queer Black men, but then we talk about the way that intergenerational trauma can affect straight cisgender Black men. So the amount of straight men who can say they have consistently been tested or go to the doctor on a regular basis is alarmingly low. Most of the younger men and some of the older men that I have been in contact with in conversations about health, they just depend on their partner's, status or their partner's health hygiene to base their decisions about their sexual behaviors or what if they need to go to the doctor. Like, that's not helpful. Because this person may not be being completely honest with you either, or there may be things that they're prioritizing that you don't think is a priority. So it really matters for you to take responsibility and accountability for your own health, regardless of how long you've been in a relationship with someone, how long you've known them. It's really important. So I've seen that impact some straight Black men in the community. So when somebody's like, "Oh, I went to go get tested," there'll be some people like, "Oh, so what you doing? You sleeping with dudes now?" Oh, you should get tested regardless
Yeah.
of who you're sleeping with, whatever their gender or their non-existent gender is, because it's all about safety. And it really, intergenerational trauma impacts what we see as real safety versus perceived safety. So when I talk about it and thinking as like a healthcare provider, we may not really get the full impact of like, oh, this is related to intergenerational trauma. But you'll see it in things like people making appointments to come for screenings, mental health screenings, or HIV, STI, STD screenings, and just not showing up on a regular basis. They've made this appointment two, three times, and they just keep no showing or canceling because of the fear of who's going to see me, what would they say, or if I found out something wrong, that's the end of everything. Not realizing how far we've come in technology when it comes to understanding mental health, understanding our physical, somatic health, and the breakthroughs that we've had in different medications and different treatments. You can see it in sometimes this fear of this doctor isn't going to listen to my story. So I'm going to be as vague or as stubborn as possible when I'm giving this information, not giving all of it because they're fearful of how this information will be used or disseminated within the community, which we know that's a HIPAA violation. I'm not telling your business, but because it used to happen,
Hmm.
that people are still aware and they still have family members where they're alive telling them these stories, it can happen. When you talk about those who identify as trans or of trans experience, not wanting to go to doctors because that doctor is dead naming them or that doctor doesn't know how to respond to some of the questions regarding where they sleep, how many partners they had, if they're participating in sex work, and they feel judged and they feel othered. So
Mhm.
therefore, they're not getting the help that they need, and they're telling other people in the community, "Don't go to that doctor. Last time I went to that doctor, girl, this happened," or they're not gonna listen to you anyway. Which is meaning they're putting their health on the back burner because of fear of
Mhm.
being misunderstood, dead
Mhm.
names, and hurt.
Mhm.
And really have to pay attention to the way that we interact with the community because of these intergenerational traumas that affect us on a societal, community, and individual level. So I know myself, I always tell healthcare workers and providers, a lot of people are tired of telling their story, whether they're coming in for a physical or coming in for testing or coming in for a specific screening.
Mhm.
Allow them to tell their story in the best way they know how. Be empathic listener. Even if that's not your experience, having the empathy that all humans can deal with anxiety and fear, and this person's responses to me may be due to those things, and that's okay. I'm not what they're scared of, but what I represent is what they fear and they're scared of. And being honest about it, like, oh, I know that coming to these appointments, it may not feel like the best thing, but after we've talked today, how do you feel? Like, and trying to really maintain a positive rapport, not judging, not generalizing. All gay folks don't like this, all trans folks, all non-binary folks, all Black people don't come from impoverished hoods. All Latinx people don't come from large families that all live together intergenerationally, but that is a possibility. But be open to asking questions instead of making assumptions. That really changes the dynamic, and getting to know the person as a person outside of their trauma. Like, we talk about the bad things that happen to you. What about the things that you look forward to waking up to every day?
Mhm.
And what makes you laugh? What helps you when you are pissed off? Like, asking those type of questions during any type of screening. You might be like, what does that have to do with anything? Being a human to another human being decent
Yeah.
can shift a narrative or shift a person's perspective and make them more open to coming back.
Yeah. Definitely. Yeah. I feel like that kind of also leads into my other question, which was more about like recognizing those subtle signs of intergenerational trauma and that a healthcare provider might sometimes overlook. So, how do you go about recognizing the signs so that we can kind of heal that doctor patient relationship that you're trying to emphasize right now?
I think subtle signs may be, like I said, people canceling appointments
Mhm.
or people not being as open when we're asking certain healthcare questions or seeming agitated
Mhm.
by levels of questioning. The one that I get, which is why I don't write in sessions, unless I absolutely have to, is, what are you writing and where's that going? So people are like, what's
Yeah.
happening in this session? And I think those subtle signs are indicators of anxiety.
Yeah.
Anxiety about what's going to be done with information. How does this person view me? Also, signs of feeling judged come through as irritation. You know,
Yeah.
I tell you that I'm a sex worker, or I tell you that I have a trauma history, and you don't ask me affirming questions and you just ask me prying questions, or you don't stop to pause for me, I'm going to get irritated and agitated because this is something that is hard for me to discuss, and you're acting like it's just run-of-the-mill conversation, and that's not helping me. That doesn't make me feel safe. Um, what questions do people skip? A lot of people in I work with in the LGBTQIA plus community, or from there may be second generation coming to this country, or first generation, questions about home life. They may not answer as willingly, or they may not answer straight up. And it's your job to, as a healthcare provider, to do no harm. So just asking, like, who helps you or who supports you with this, or Who is there when you're coming to eat dinner, coming to make a meal, instead of how many people live in your house and what are you occupied?
Yeah.
Asking questions that are more structured around how this person sees life on day to day will get you more than do you feel harmed by anyone in your household? So I may ask that question if a person is skipping around questions about violence or disturbance. I may say something like, we're all going through a lot right now. In the last 4 years, in the last year, and relationships and dynamics have changed. Sometimes you wake up and you love someone, and the next moment you wake up and you don't understand anything about them. You
Mhm.
feel like that? And in that
Mhm.
question, we get to talking, and I'm like, yeah, because sometimes when we don't feel like we feel like we don't know the most about someone, or they're changing in a way that's not necessarily positive, it
Yeah.
can make us feel uneasy. It can make us feel unsafe. I know I've gone through that before. What's that like for you? And being able to
Yeah.
reframe and reword questions that are more personable rather than prying,
Yeah.
because we're trying to eliminate this high level of intense anxiety and mistrust.
Yeah, definitely. Especially because I feel like our normal emotions and reactions can always be perceived as something that they're not. So if we're anxious, like you said, it might come off as we're agitated or we're being aggressive, but it's not that. We're just anxious. We're experiencing normal human emotions.
Hmm.
So definitely like recognizing those signs and picking up with those things will help us not turn people away and shy people away, and then go out in the community and tell other people to not go to the specific person for sure. And I feel like you kind of already answered my next question, which was kind of just saying, how can healthcare settings evolve into spaces of healing that really acknowledge that intergenerational trauma, but actively work to dismantle all the disparities that they do perpetuate?
Oh, yeah, some of that I touched on, but I think what a lot of community healthcare agencies need to do is partner with people in the community, community advocates, people who are heavy in their neighborhood that people know for resources, the moms, the mothers, the dads, the house fathers,
Mm-hmm.
the lady that knows every single child in the neighborhood, bringing those people in and giving them a chance to tell their stories. I always say experience makes us an expert. So we have a lot of lived experience experts within our community. Just because they don't have a title doesn't mean that their experience, their wisdom, and the way they interact with the community should not be applauded, because those are the people who get you together. Those are the people who they always know where the food drive is, where the book bag
Yeah.
drive is, all of those things, going into communities in the schools, providing screenings and services free of charge, being able to partner with other programs like, for instance, one of my daughter's schools, they're a part of a program in the district where the kids get free eye exams and free glasses. So they also work with uh they get their food catered by one of the community kitchens. So they're always feeling like they're better than everybody's school lunch. And it is true, it is better. But doctors are coming in and reading, and dentists coming in and showing you the tools and using, like, oh, okay. We have social workers who come into schools and just check in. One of the things that we do at my daughter's school is we have every third Wednesday of the month, we have a parent chat and chew, where we literally all parents come and sit. I'm a healthcare provider, so I provide free services to the teachers at my kids' school, and I do social emotional learning activities with the kids there. Social workers come in and they're like, we're talking about everything we have. Do you want services here for you? Do you want services for your child? Bringing it out of the office and bringing it actively in the community, it makes it less daunting, less anxiety inducing, less scary, less sterile. You know, most people you see me on the street, you're like, who this girl with all these colors on this right here? It was people who were like, I would think that's a doctor, but I am. I show up
Yeah.
as my true and authentic self, and I never let
Yeah.
my title make me feel stuffy or make me feel like I'm too far away from my community. Because once upon a time,
Yeah.
I didn't have insurance and I have a lot of healthcare conditions. And I had to really think on my feet about how things would manifest for me so I could get healthier. So I think we talk about the technology, but we don't talk about the rapport building that really will help a community. Going out and doing clothing drives, providing clothing boxes and things and lunches that people can come in and get because it's all about meeting needs. If I can get a sandwich and I can get some clothes, if I'm a kid that wants shoes and my shoes too tight, and I can get my dental screening or an eye exam at the same time, oh, we're going to do that. Oh, I'm not only giving you HIV AIDS testing, but I'm also doing your
Yeah.
whole screening for STIs. And guess what? Get this flu shot and this COVID shot if you want to.
Yeah.
All of
Just
those
like that.
things.
Yeah.
Yes, connecting the worlds
Yes.
and making it not a doom and gloom, making it this is a normal thing. These people live in your community. When I'm out running with my crazy dog, you know, how many people call my name, hey, Dr. Vivian, hey, Dr. Vivian, because I'm out here. And
Yeah.
I'm not saying that as a flex or to boast, but it is an honor for people to know me and my community and know if she's here and I have an issue, I know something's going to get addressed. We got to
Mhm.
go back to that style of
Yes.
community and community living, community focus, and not be so stuck in this individualistic point.
Yes. Yes, exactly. Because the only way that we are going to heal is through community. And I feel like that's something that's been echoed so many different times. But just being isolated and already not having your needs met, and then having to have an individual appointment for this, and then for that, and then for this, and then for that. Are you supposed to take time off work to do that? We all have to work. We all have things to do. There's so many things that's why our health gets put on the back burner. It's even harder for us as Black people because we don't have the luxury all the time to go and do all those things that we need to do, like scattered throughout the day. Like it's just not always an option for us. So that's just really like, I just think that's so wonderful that the providers are actually coming to the school and doing that. Like I feel like that's just so beautiful because not only are you guys getting taken care of in the way that you need to, you're also like inspiring those children and they're like, okay, like the doctor isn't actually just a scary person with the white coat, that's the person that reads to me at school. Maybe one day I want to do that. And that's how those like little seeds get planted. Like that's what we want. We want people that grew up in communities going out to be the next generation of healthcare providers so that we can keep chipping away at this intergenerational trauma truly.
Yeah.
So yeah, it kind of leads to my next question, kind of because we know that intergenerational trauma, this is a very huge
Mhm.
problem that we can't just fix in one day. And we're going to need to fix it through community. But if we were to ever encounter any kind of resistance when it comes to changing that narrative that trauma has really created for us, how do you think we should go about that?
Understanding that resistance comes from a place, it does not just appear out of thin air. Resistance is due to ignorance, and I'm not saying this well, some people confuse ignorance with stupidity. Stupidity. Ignorance
Mhm.
is not knowing.
Yeah.
So resistance comes from not knowing. Resistance becomes a fear of the unknown or
Mhm.
fear of or anxiety related to or anger related to past historical events.
Mhm.
So when you encounter that resistance, you are countering it not with, well, if you don't want to get seen today, you could just leave or make another
Mhm.
appointment. Instead, countering with empathy, countering with inquisitive questions instead of irritating questions. I know this maybe it's seeming like this is a lot for you today. You know, are there other things going on? And this just seems like it's one more thing. You know, I get it. I don't like being in the doctor's office all the time. My favorite thing to let people know when they're resisting with me in therapy is this session is yours. I'm a collaborator working with you. So if you give me what you have, we can work with it. If you have nothing today, you can sit in silence if that's the gift you have to give yourself. And guess what? For the next 50 minutes, you don't have to worry about anybody questioning your silence. And so many people respond to that. Like they after 5 minutes of not talking, they're like, you really gonna just let me sit here and not talk? If that's what your spirit needs, so it's really about tapping into it. When we talk about there's a lot of sometimes I would see with maternal health, especially Black maternal health, because our mortality rate is higher than any other group. So you'll
Mhm.
see women like not really being gung-ho about going to their doctor's appointments. And especially if I have a list of all these things I'm talking about, and you're trying to push me out. Or I had one baby and a lot of things came up and this doctor didn't hear me. And because of that, I have medical trauma. So now
Yeah,
here I am a couple years down the line, and my doctor is like, they don't seem happier. They don't seem enthusiastic at their doctor's appointments. Inquire about why instead of taking it personally. So many things in the medical field, it can be so quick for you to take somebody's attitude or their standoffishness or their stubbornness as a personal attack. It's not a personal attack, it is a societal narrative and you need to read into it. So don't take things personal. And what you should be taking personally is how am I coming off to this person? Well, how are they not landing softly? How are they not landing safely with me? How could I make this a safer situation for them? And
yeah,
changing the narrative means putting community focus on and reflecting about how you want to be seen in the community and what you want your community to have access to instead of this person is non-compliant, this person is resistant, this person is responding to what the narratives that they've heard from their families and their friends and the narratives that they have been forced to tell because of their own lived experience. I can't change what happened to them, but I can change what they encounter with me.
yeah, yeah. That's a really wonderful perspective. Definitely, definitely. So, how do you think that healing from this intergenerational trauma looks like? What does that look like to you?
I like to say it looks like Gen Z. That's what I like to say. As a millennial, I think seeing, your cohort and cohorts after how y'all respond to injustice, how you respond to misinformation, how you respond to lack of resource is beautiful. We were the talkers and the shakers, and y'all were like, no, that's cool. I'm a yell. And I like
Yeah,
that. I think healing from intergenerational trauma looks like strength to stand up in the face of adversity and go, okay, I know that's going on, but it still doesn't make it right. Healing in the face of intergenerational trauma means you see friends. I love when I see best friends coming to therapy together. That lights my spirit on happy fire. It's like, oh, you're having conversations and you're bringing your friends to therapy to talk out your stuff because you consider them family. And even though your family doesn't feel the greatest about therapy, you're like, well, I want better relationships. Chef's kiss. We love it. Healing from intergenerational trauma also means I'm going back in my community, going back to my family and my friends with resources and not judging them because they've waited so long or they haven't, utilized certain things or they don't know how to do certain things. Healing from intergenerational trauma is change that is necessary for us to live softer lives, us to live these lives that aren't so hyper vigilant, intense, and we have to be strong all the time. We are learning how to take care of ourselves. We are learning how to be softer with ourselves, our children.
yeah,
Healing from intergenerational trauma means I didn't yell at my kids this morning when it was taking forever to get to school. I pointing out to them, you know that class that you really like? You're about to miss music. And I don't think you want to do that. So I know how much music means to you. I know how much you dancing with your class before the lesson means to you. So let's get it. Let's put some
Yep.
pep in that instead of telling them all the things that they messed up this morning.
Yeah.
You know, it
Yeah.
even means talking to yourself differently
Mhm.
and catching yourself at moments of really being hard on yourself and ragging on yourself and being like,
Yeah.
girl, you're doing too much. You had a hard day, so you were late for class or late for work, but you showed up and that's what matters.
Yeah. No, definitely. I just love how you emphasize like just being soft in general, soft with yourself, soft with the people you're interacting with, because it's very hard to always feel like you're on the defense, to always feel like you need to like be, like you said, hyper vigilant, because it's very exhausting to exist in a world that's already forcing us to have this kind of like hard shell.
Yeah.
So the only way we can like really take a deep breath and start healing is if we just learn to just, be softer in the smallest of instances, because it will really make the world of a difference. I feel like just things like that will always just help you be able to interact with life just a little bit better, as hard
Yeah.
as it can be sometimes. And are there any like practices or community driven interventions that you see have already shown a lot of promise in kind of bridging that gap in the trauma informed care that we have? Specifically when within like HIV, like I know you talked about having doing your HIV testing and all those other testing and treatments that you can get. But is there anything else that you've seen recently that's showing a lot of promise?
Yes. I have seen so many people respond well to these mobile pop-ups that are able to provide testing, but are able to also provide psychoeducation or health education with the testing,
Wow,
or
yeah.
combining it with, you know, harm reduction strategies. So
Mhm.
helping people get access to Suboxone, methadone, Narcan, and here is help with housing. And you can come to this meeting and see if you qualify for this group. If and you may be able to get help with rehab, or here is where we're going to be out giving out food and clothing, and you're going to get some type of educational task. When we combine services with
Yeah.
education and things that are necessary for living for any human being, you're going to have a better outcome. One, you're going to bring more bodies. We love free things. We love, that's it. That's the nature of humans. We love free things, but we also love one-stop shops because it makes it easier. Like for the mom
Mhm.
who has to, I know a mom who has three kids and they all go to three different schools because of the age group. So me being able to talk to the van, go to the van and get screening or get paperwork for resources and housing or legal aid all in one, that's
Yeah.
amazing. So I don't have to figure out how to bounce back and forth between the wards to get help. Another thing that I love seeing is when communities or clinics hold like monthly parental talks or community talks, whether it be queer focus, women focus, men focus, family focus. People like being able to talk to their providers when it is not a reactive situation, it is a proactive situation, because it removes the stigma of going to the doctor is related to something bad, and you start to see like fruitful, things happening from it, or people having people with lived experiences be in educational talks or connected with workshops, connected with festivals, connected with drives has shown promise, because people like people who come from familiar circumstances and same lived experiences. And I
Yeah.
find that that brings more bodies in than a big name,
Mhm.
because Dr. Sheila is renowned for this and has this many prizes and the head of this department. But Dr. Sheila didn't knock on my door because she hadn't seen me out in 3 days and wanted to make sure that I took my meds like this person in the community did, and then brought a plate from this place and was like, where do you need to go? Do you need a CSW? Do you need to get your pills? Those are the people that help make a difference.
Yeah.
And also, I think going into schools and starting young doing community driven interventions, what it does is create a level of familiarity with the youth with these programs, and they start to become more informed. So by the time in DC, Maryland, and Virginia, the age of consent ranges from about 12 to 16 when it comes to certain services. So if I'm
Mhm.
talking to you at elementary school about your health and your mental health and wellness and screenings young, you have this information, you develop the relationship with doctors in the community, and you're
Yeah.
more likely to seek help, even if the parents or the caregivers in your household aren't as informed as you are.
Yeah, definitely. Wow, that's so wonderful. I feel like that just makes me have more like hope for us healing as a collective because it's entirely possible as long as we just pour into our community. So I
Absolutely.
really just I want to thank you so much, Dr. Elliott. Like this has really been such a wonderful conversation. Is there anything else you'd like to add? Any other closing thoughts you have?
Well, it's been a pleasure meeting with you today, Ashley. And I know that with those majors, honey, you're really going to be doing some big work in the community. We love it because we need more of you in this community being true representation. And to anyone listening and yourself, remember that being soft with yourself is not allowing yourself to get away with things. It's allowing yourself to understand that grace and patience are worthy of you and you are worthy of them, just as you extend those thoughts of grace and patience to other people. And healing is continuous. So even though it feels like I should have it all together, nobody has it all together. And the only way to keep yourself together is to continuously heal and work on it every day.
Thank you so much. That was so wonderful. I just want to thank everyone for tuning into this episode of the podcast. We hope you found this conversation engaging and informative. And if you found today's episode engaging, we do encourage you to tune into our upcoming episodes covering topics like stigma and the impact of PrEP and HIV prevention and early HIV prevention for young girls. Remember to subscribe, rate, and review our podcast to help us reach more listeners. Until next time.